Welcome to this edition of the First Aid Show. Strokes are something that you need to identify as soon as possible and ensure that the EMS know that you suspect a stroke. We asked a paramedic to explain more about strokes.
So a stroke is a time-critical emergency. If we think of it like a brain attack, there can be different types of stroke and they present slightly differently, but the most important thing is to call for help and make sure that we're coming to get that person properly assessed. So sometimes people will have what's called a mini stroke or a TIA, Transient Ischemic Attack, and what's happened is there is some sort of clot or blockage that is stopping the oxygen going to the tissue in the brain that might cause slurring, weakness in the face, in the limbs, any sort of strange presentation like that, unable to speak or finish sentences. Absolutely call 999 for help. If that clot is bigger and causes a blockage, it might develop into a full stroke. And again, you are looking for the acronym that's FAST, F-A-S-T. So F is to look at their face. Is it symmetrical when they look at you, or are you noticing that one side looks a bit droopy? Maybe they're drooling on one side. A is for arms. So can they lift their arms, elevate their arms and keep them elevated, or is one just fading away? You will often find that the droopiness on the face and the arm will be on the same side. S is for speech. Can they speak in full sentences? Can they find appropriate words within the sentences? If there is anything changed like that, that's not their normal speech, that it could be a sign. And the last one is time. It is time critical. You've just got to call for help. The other type of stroke that people can have is they can have a bleed or a hemorrhagic stroke. So that's when there's a weakness in one of the vessels that causes a bleed that again stops oxygen going to the brain. In that situation, as well as the fast signs and symptoms, you might also find that somebody might have a seizure or become unconscious. But any of the symptoms that are not normal, please do call for help. So you can keep them safe, make sure they can't hurt themselves, and do whatever you can to prepare them to be able to go to hospital quickly. So getting their medication, letting a close relative know that you've called for help, keeping them calm and relaxed, that they're not going to fall over or hurt themselves if they're having a seizure. All of those things are really important and can help the patient.